Madam Speaker,
Mr. President,
members of the board, delegates, colleagues, and guests. It's truly a privilege and a pleasure to speak to you today as my presidency nears an end. It has been an amazing year. My sincere thanks to all of you for the support and the encouragement that you've given me during my time as your president. Over the past year, I've spoken to this House about the critical importance of physician leadership, to advocate in today's political environment, to describe and shape the future of healthcare, and to mentor those who will one day follow us in this profession. Now, as my time winds down and we prepare to transition the AMA presidency to the very capable hands of Barbe McEnany, I'd like to share some parting thoughts about physician leadership, AMA physician leadership in particular, and the important gains we've made and the work that remains. A year ago, I asked all of us to consider this question: what kind of leaders will we be? And I challenged us to be the kind of leaders who bring consensus to difficult issues, who use our creativity and drive to shape the future of medicine, and who mentor our next generation of physicians. And then, at our interim meeting in November, we looked at the kind of leadership that is needed to produce a winning team. Like other winning teams, the AMA shares a common vision and works aggressively to achieve it. The AMA led the way on health system reform last year because of our shared vision of maintaining and expanding health coverage for Americans. Winning teams create partnerships that make us stronger. Let me give you an unexpected example. Anthem, the health insurance company. Who would have imagined a few months ago that we would not have only convinced Anthem to back off of its plan for a 50% cut whenever the CPT 25 modifier was used, but that we could extend that dialogue to work on patient literacy, right-sizing prior authorization, and other payment issues. Amazing. And winning teams chart a course for a better future. The AMA continues its aggressive advocacy to reform the crippling prior authorization processes that delay patient care, to reduce the regulatory burdens on physicians, and to improve the EHR and other information technologies, all of which currently take too much of our time away from our patients, and they waste precious resources. We've carried that strong momentum into the first half of 2018. To the casual observer, it might seem that Congress only works in the dark of night, at the last minute, or when they're up against a deadline. But even those late-night deals, such as the 2-year budget deal in February, are the culmination of months and even years of hard work and negotiation. Kudos to our advocacy team, and kudos to all of you, our physician advocates, for several wins on key issues for the AMA this past year. I want to name a couple of those. We have long fought for improvements to the electronic health record and an easing of the unrealistic federal requirements. The budget deal eliminated a mandate making EHR standards more stringent. And we have long fought for repeal of the Independent Payment Advisory Board, or IPAB, which gave too much power to an unelected body to cut Medicare payments. The budget deal repealed IPAB. And we have long fought for federal safety net programs like the Children's Health Insurance Program, or CHIP. The budget deal extended the CHIP program 10 years. And we have long fought for changes in the MACRA law to provide greater flexibility for physicians participating in Medicare and to encourage the development of alternative payment models. The budget deal included important improvements to MACRA as well. Along with all these provisions, the AMA was also able to stop a very bad proposal that was initially included in that package, a misvalued codes policy that would have led to across-the-board Medicare payment cuts and a conversion factor that was actually less than when the SGR was repealed. We were able to stop that provision. These wins were only possible because our winning team put in the hard work of advocacy. We took a stand, educated policymakers, and we activated our grassroots physicians to speak with their legislators. This process can take days, as in the case of the misvalued codes policy, months, or even years, as in the case of IPAB. So we must remember that it is important that we keep fighting all the time and not lose momentum or become discouraged because of temporary setbacks or because nothing seems to be happening. So yes, it takes leadership. It takes a team that is persistent, but it also takes innovative, dedicated individuals. The AMA is fortunate to count among its members some of the most talented individuals in the country who are leading the way on a variety of healthcare issues. Nelson Mandela, the former South African president, said, "There are times when a leader must move out ahead of the flock, go off in a new direction, confident that he is leading his people the right way." It's that concept of leadership that I'd like to share with you today, how some of our individual AMA members are moving medicine. The opioid crisis continues to reverberate through our communities and is now the leading cause of death. The leading cause of death among Americans under the age of 50. That is a national tragedy. And it demands that our profession continue our diligent work to end it. And that is exactly what we are doing. Due to the hard work of our opioid task force and other organizations in recent years, we are making headway on several fronts. More physicians are becoming certified to provide medication-assisted treatment. More physicians are registering for and using their state PDMPs and completing education on safe opioid prescribing. And perhaps the best news of all, opioid prescribing has decreased for the 5th straight year in a row, now down 22% from 2013 to 2017. However, despite these efforts, deaths from opioid overdose continue to climb. Addiction is a fierce adversary, and no one understands this better than Dr. Jerome Adams, our Surgeon General and AMA member, who's made fighting the opioid epidemic his top priority. Dr. Adams understands the devastating toll that addiction has on individuals, families, and communities. He is very open about his younger brother's struggle with substance abuse disorder that has even led to time in prison. And he encourages all of us to fight the stigma around substance use disorders. And he has written, and I quote, "We must also acknowledge that addiction is a chronic disease that changes the brain, not a moral failure." As Indiana's State Health Commissioner from 2014 until last year, he fought for and implemented a wide range of interventions, including needle exchange programs, wider availability of naloxone, and better access to evidence-based and comprehensive treatment. Dr. Adams recently issued an advisory, the first advisory from the Surgeon General's office in more than a decade, an advisory on naloxone and opioid abuse. And that advisory urges those at high risk for opioid overdose and their family members and friends to ask their physicians or pharmacists about naloxone, to learn the signs of opioid overdose, and to get trained to administer naloxone in the case of an overdose emergency. We strongly endorse the advisory, and we applaud Dr. Adams for issuing it. And we look forward to hearing from him directly as he addresses this House on Monday. So Dr. Adams, thank you for being an AMA member moving medicine. Would you stand and let us recognize you? Thank you. Another top advocacy priority in recent years was repeal of the sustainable growth rate formula and then helping physicians make a successful transition to the new MACRA quality payment program. We've worked diligently with the Centers for Medicare and Medicaid Services, or CMS, both to reduce physician burdens under the new law and to create physician-focused payment pathways called alternative payment models, which reward physicians for their creativity in improving healthcare quality and in reducing costs. Understandably, there is some fear and even some resistance to moving to these new models. Thankfully, there are AMA members like Dr. Larry Kaczynski to help show us the way. Dr. Kaczynski is a gastroenterologist from Elgin, Illinois, who's developed a specialty medical home for patients with Crohn's disease. Several years ago, he analyzed the claims data on Crohn's disease patients and found that hospitalization for the treatment of complications drove much of the excess cost. But, as importantly, he also learned that fewer than 1/3 of the patients who ended up in the hospital had any contact with their healthcare provider in the preceding 30 days. So he developed a system that he called SONAR to intervene with patients before they even realize they need it. The way Dr. Kaczynski describes it is that patients are like submarines. They're out there underwater, but they only come in when they are in trouble. Now, instead of waiting for patients to call when their condition worsens, Dr. Kaczynski's office pings each Crohn's patient every month, asks them a few structured questions, and that way he can intervene quickly if a patient's responses suggest that his or her condition is worsening. This SONAR program has cut hospitalizations in half, has reduced spending, and actually improved patient satisfaction. Last year, the Physician Technical Advisory Committee, or PTAC, recommended that Medicare program test his SONAR model. Think of the patients who could benefit if they can avoid hospitalization. And all because of one physician had a really good idea and pushed hard to make it happen. So Dr. Kaczynski, we thank you also for being an AMA member moving medicine. Round of applause. And another group of members that I would like to recognize today are the medical students who are fighting to protect DACA status individuals. You'll recall that the DACA program shields hundreds of thousands of undocumented young people who came to this country as children and allows them to work. Dozens of medical schools have considered, and many have admitted, DACA status students, understanding the value that they can bring to the healthcare system. Research tells us that DACA status individuals can help us alleviate the physician shortages, especially in high-need areas, and provide culturally competent care. Some of our own AMA members have DACA status. They're our colleagues. Protecting them is a priority that has increased in urgency in light of the actions to terminate the DACA program. So during our 2016 interim meeting, one of our members confided in another member fears of being deported. That friend and other supporters within the medical student section immediately sprang into action. They stayed up all night writing a resolution to call on the AMA to go beyond studying the issue and to take a stand, to go on record in staunch support of healthcare professionals with DACA status. And to his credit, Bob Goldberg, a member of the AMA's Council on Medication, introduced their resolution, and it was adopted with overwhelming support from the entire House. Indeed. So led by the medical student section, the AMA continues to pressure Congress to enact both short-term and long-term solutions for DACA status individuals in the medical community. So to the leaders on the DACA issue in the medical student section, like Pratista Korala, Ruth Howe, and many others, and the people that supported them, like Dr. Goldberg, thank you all for being AMA members moving medicine. The final group of physicians who are moving medicine forward are sitting in this room today, and that is you, the delegates, alternate delegates, and trustees of the AMA. Today, I challenge each of us to think about the significant wins we have achieved by working together as a winning team, and to think about the individual AMA members moving medicine whose examples I've shared, and also about the significant work there is still left to do as we strive to shape a better future for students, residents, physicians, and our patients. So let us each ask ourselves, how can we get even more involved, become even more effective, and actively encourage more of our colleagues to join this transformational organization that is our AMA, so we can truly continue moving medicine forward. At this meeting, we will have an opportunity to demonstrate physician leadership on a public health crisis that has so far defied solution: gun violence. At the start of our annual meeting in 2016, shocked by the Pulse nightclub massacre in Orlando, this House acted. We led with a critical declaration that gun violence in America is a public health crisis. But in the 2 years since that time, we have been horrified by yet more carnage. In Parkland, in Sutherland Springs, Santa Fe, Las Vegas. And those are just a few of the incidents that made the headlines. On average, gun violence claims the lives of nearly 100 people every day in the United States. People are dying of gun violence in our homes, in our churches, in our schools, on our street corners, and at public gatherings. Colleagues, we, the American physicians, have an opportunity, and I would suggest we have a responsibility in the coming days to act on several resolutions that address this devastating crisis of our time. The AMA has demonstrated leadership on this issue for decades. We've recommended common sense gun safety protections, waiting periods and background checks for those seeking to purchase a gun, and increased funding for mental health services. We've called upon the Center for Disease Control and Prevention to conduct epidemiological research on gun violence. It is perhaps the only leading cause of death where such research is not being conducted. Yet, the fact that this problem continues to worsen has spurred a new sense of urgency in this House, even while Congress fails to act. To those who feel we should not address this as an organization because it is too controversial, I would ask, did we shy away from fighting discrimination against AIDS patients in the early days of that epidemic, even though much of society stigmatized those with HIV? No. We let science lead us. And did we mute our opposition to smoking because big tobacco defended it? No. We let science lead us. And even now, have we backed away from our support on universal vaccinations or the gains made through the Affordable Care Act because they're controversial? No. We've let science lead us. So similarly, I would submit to you that the AMA must not back down from addressing gun violence. On the contrary, we must address it head-on, scientifically, in an evidence-based, principled fashion, and with the health and safety of our communities, our fellow Americans, and our children as our chief concern. And while we will not all agree on every proposal introduced on gun violence, we can all agree that this issue must be addressed, and that the only responsible way forward is for women and men of good faith to continue to search for and advocate for science-based solutions. That is true physician leadership, and that is our AMA. Thank you.